The core values of the Alexian Brothers are dignity of the person, compassion, care of the poor, holism, and partnership. And we really believe that that's at the center of our epilepsy program and the treatment of our epilepsy patients.
What makes Alexian unique is the service that they offer, this really, really generous charity program that has made such a difference in so many of our patients' lives. They can't get diagnostic tests. You know, an MRI can cost $5,000 and up. And here, you know, the hospital is willing to absorb that.
Through this clinic, we're able to provide them care that they otherwise wouldn't get, especially medications and access to care. It's extraordinary that Alexian would allow us to do that.
I help with the no-charge medication. Once the doctors decide on a therapy to use, I can enroll the patient in the pharmaceutical patient assistance programs, where the pharmaceuticals are generous enough to allow people without insurance to get their medication at no charge.
Our programs are comprehensive. And when we say comprehensive, again, it's not just about bricks and mortar. It's not about technologies, although, again, you know, we believe it's important to make those investments. But really, everything that we do, quality has to be at the forefront. And quality is measured by scientific measurements, but it's also measured by that care and compassion that really is at the core of our mission and the Brothers Ministry. And so it's that human element. So that quality is also measured by the successes that we achieve with our patients, where you can celebrate those wins, where you can cry the tears with the patients when things don't happen as you wish they would happen. But that, to me, is quality as much as the advancements in the medicine.
One of the keys to the whole thing is you don't give up and you keep on. There's always things to try, and not all of them work, but again, there's always something more you can do. And again, sometimes it's very important, the person who's on 4 and 5 medications, just taking them down to 2 medications. They might still have the same number of seizures, but then they'll feel better because they're not have such drug load.
I love them. They're wonderful. They're just very quick to get back to us, and they're right there to meet our needs. And as silly and simple as it is, when I call them, they're right there.
No matter what you need or how stupid you think a question is, there's always somebody there.
We've got such a great support team. The staff is wonderful. The doctors are genius. They do such a wonderful job with the patients. The kids are well cared for, and you know, it's a great collaboration.
The greatest thing about our epilepsy program has been the great partnerships that we've achieved, both in terms of our academic relationships as well as the relationship with the Epilepsy Foundation.
If it weren't for the collaboration, we would not be able to see the patients without the insurance. Alexian Brothers Health Network has a very generous patient assistance program. So for the uninsured that come in, they give me a call, I'm able to get an application from the charity representative here at the hospital. The patient fills it out with their financial, sends it in, and I would say in 90% of the cases that patient's approved. That patient can access medical care from the doctor here at the clinic. That patient can get lab work and can also get EEG and MRI. So it's a huge, comprehensive set of tests that the patient can get at no charge.
Again, we're pleased to be here. All the docs enjoy coming to this clinic, and I think that it was part of Alexian Brothers' mission. Charity care is one of the Alexian Brothers' missions, and again, I think that they're more than willing to partner with us to provide care, even those who can't afford it. That's a big issue now in the treatment of epilepsy.
The health system remains heavily committed to the epilepsy program. You know, we will continue to invest, we'll continue to grow our programs, we'll continue to reach out into our communities and provide greater access, because this is core to our mission and to our ministries. This is a vital program for our health system, and you know, we will not rest until the program achieves our goals.